This conference will now be recorded.
Okay. Before our moment of silence, I would like to take a second and offer our condolences to the Mattioli family on the passing of Dr. Rose, the patriarch of a family that has been so philanthropic in our area. The foundation has done so much for many parts of Monroe County, so we'd like to, our hearts go out to them and thank them for the work that they have done. Okay, and now a moment of silence, please. And now the pledge. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. See, at this time, we will be having a public hearing for the HAP HSDF grants, and I'll turn it over to Jen at this point. Thank you.
So our Human Service Plan is part of the Human Services Block Grant. Monroe County is a non-block grant applicant as part of a local collaborative with the Carbon-Monroe Pike Mental Health and Developmental Services. Monroe County applies for and administers two non-block grants, the Homeless Assistance Program and the Human Services Development Fund, which is Appendix B in our Human Services Plan. In the Homeless Assistance Program, we plan to serve 541 individuals. Of those 541 individuals, 78 will be served through Pocono Area Transitional Housing, which will provide short-term housing and supportive services to homeless families in Monroe County. The primary goal of Pocono Area Transitional Housing is for participants to obtain and maintain their own housing after receiving counseling on personal finance, employment, education, job training, and doing a housing search. 38 will be served through Family Promise, which has seen a trending need for rental assistance due to COVID-19. Rental assistance is a critical part of an effective homeless crisis response system. Family Promise in Monroe County will use rental assistance to rapidly connect families and individuals experiencing homelessness or at risk of homelessness to permanent housing. 300 individuals receive emergency services through Women's Resources, a domestic violence shelter, and the Salvation Army with individual and family shelter units. At Women's Resources, participants receiving counseling services to assist with planning for future safety, education, community resources and problem solving, accessing transportation and childcare, and work or training. In addition to shelter for homeless individuals and families, the Salvation Army offers counseling to understand their homelessness condition and advocacy to acquire permanent housing and other needs and mainstream resources. 125 individuals will receive case management services through RHD Street to Feet. The Homeless Day Center provides innovative and comprehensive services to empower people of all abilities as they achieve the highest level of self-determination possible, getting them off the street and back on their feet. Street to Feet is also a walk-in site for the coordinated entry system, which connects individuals experiencing a housing crisis with the most appropriate level of care by entering individuals and families on the by name list in the Homeless Management Information System. In the Human Services Development Fund, we plan to serve 13,808 individuals. Of those 13,808 individuals, 45 adults who are blind and visually impaired will receive escorted transportation services from the Center for Vision Loss to area medical facilities for critical access to care. 13,000 individuals will receive coordination services through through Pocono Mountains United Way, which provides information and referral services that have been vital to the COVID-19 community response. 12 individuals with mental health illnesses will be assisted by the Carbon-Monroe Pike Mental Health and Developmental Services in securing and maintaining housing that is safe and affordable through service planning, transportation, and counseling services for those who are mentally ill or developmentally challenged. 751 individuals will be served through the Pocono Services for Families and Children, which is a true generational approach. Family advocates work directly with all enrolled families for education, housing, healthcare, employment goals, financial stability needs, and any additional resources as needed to assist families to reach their personal goals. That's everything.
Okay, thank you.
Thank you, Jen.
Any public comment or questions for Jen? Nothing online, nothing in the room? Do we make a motion to accept?
Yeah. It's just the public.
Just a public hearing, okay. Thank you. Moving on. And for the public that may be listening virtually, that will be, we can have that to be posted with everything.
Yeah, we will post the whole human services plan, and
Yes.
it actually gets posted on the state website as well.
Okay, excellent. Thank you for that information. Okay, public comment, agenda items only. Anything in the room? Anything online? Okay, thank you. Okay, thank you. Old business. Do I hear a motion to approve the minutes of the 6/17/20 Commissioners meeting?
So moved.
I guess I second it. Is that correct? Okay. And there's a second. All in favor?
Aye.
Aye. Opposed? Okay. Thank you.
I make a motion to ratify the electronic bids for bridge and deck cleaning, and also amend motion 2021-157 to reflect increases in computer capital.
Okay. So items 2 and 3 of the old business area, and now we'll second that. All in favor?
Aye.
Aye. Opposed? Okay. Seeing none, hearing none, moving on. There are no proclamations or certificates today. New business. Personnel. Items A and B.
Make a motion to approve the additional work in the treasurer's office, the sheriff's overtime, and electronic financial transactions to vouchers payable, gross payroll, Highmark, Blue Cross Blue Shield, Geisinger, flexible spending, dental claims, and Connect Your Care.
Okay. Let me see. Okay, so we went all the way through those items. And I have a second here for me. All in favor?
Aye.
Aye. Opposed? Okay. Moving on. Thank you. Number 3, travel authorization. There are no travel requests at this time. Number 4, Monroe County Area Agency on Aging. Parts A, B, and C, item 4. First, do I hear a motion?
So moved.
Is there a second? Me? Yes. All in favor?
Aye.
Aye. Opposed? None. Number 5, Monroe County Children and Youth Services, Parts A, B, and C. Do I hear a motion to accept?
Make a motion to accept.
And I will second that. All in favor?
Aye.
Aye. Opposed? Okay, thank you. Commissioner's Office. We have Parts A through J. How do you want to handle it, John? Do you want to?
I'll make a motion to accept the commissioners A through J, but open for discussion.
Yes. Okay, so we have a motion, we have a second. There will be discussion at this time. Any discussion on any of those items?
Yeah, the first thing that I wanted to point out is the budget adjustment for $15,379,495 is the influx of the CARES money into our budget that will then be dispersed back out to the community. We're setting up a process for small businesses. We're also looking for small business. We have nonprofits that we're looking to help everybody that has had a injustice, so to speak, during COVID financially.
And also the different municipalities.
Correct. Fire companies,
Ambulances.
So that's a big nonprofits. It's a big shot in the arm for Monroe County.
Okay. Anything else that we should bring up? I think that looks like it, pretty much. Okay. We had a first and we had a second. We had discussion. All in favor?
Aye.
Aye. Opposed? Number 7. Monroe County Correctional Facility.
Make a motion to accept the contract with Trinity Services.
Which is their food service agreement.
Correct.
Okay. We have a motion and a second. That would be me. Any discussion? All in favor?
Aye.
Opposed? Okay, number 8. Monroe County Office of Emergency Services, execute an agreement with Pocono County's Workforce Development Board. Do I hear a motion?
So moved.
And I think it's important to even mention that it's to receive funding for students to take the EMT training, which I think is really important information as well.
Right. If you can't afford the EMT training, what you can do is contact CareerLink. They'll qualify you, and then you can take the EMT training.
Okay, so I have a motion. I'll give the second. Any discussion? None at this time. All in favor?
Aye.
Aye. Opposed? None. Number 9, capital outlay purchases. Item A. Do I hear a motion?
So moved.
And I'll give a second. Any discussion? Nope. Hearing none, seeing none. All in favor? Aye.
Aye.
Opposed? Number 10, computer capital purchases. Ratify the computer capital purchases.
So moved.
And a second. Any discussion? Hearing none,
No.
seeing none. Do you have any?
Nope.
Nope. All in favor?
Aye.
Aye. Opposed? None. Okay. Miscellaneous. Before the public. Any miscellaneous?
I do. It's the 4th of July coming up. A friend of mine is a hand surgeon. He says it's his busiest time of year. Please be careful. Please be aware of your surroundings when you're setting up fireworks. And if you don't have to set them off, don't set them off. You can't reconstruct your hand very easily.
I agree. Thank you for that, for those words. And I would like to, and before any public comment, if there is at this point, I'd like to end with, after hearing so much on the news and seeing a resurgence coming back into parts of the United States, I think it's really important, after listening to doctors and understanding what they're saying, and in the end, it's the community that will stop the spread and control the virus. And that's us. That's us wearing our face guards. It's us sitting here and distancing, and it's what we need to do as a community to move forward and to not have a resurgence here in East Stroudsburg and in Monroe County and Stroudsburg and Pocono Mountain and Pleasant Valley. So thank you all for the work that you're doing to the community. Public comment. Okay.
Motion to adjourn.
We have a motion to adjourn. I'll second it. All in favor?
Aye.
Aye. No one's opposed. Okay. Thank you.